Good afternoon, everybody, and welcome to the briefing on the 2024 Milwaukee County Department budget request as submitted to David Crowley, our county executive. Today is Tuesday, August 28th, 2024. I always have to remind myself of that because it's only partway through the year and my calendar fell apart. So what I wanted to say was to remind everybody of the Milwaukee County 2024 budget town hall meetings. There are 4 town hall meetings that are happening. If you want to sign up for those, in your packet is the email address. And if you don't have a packet, you can go to the Milwaukee County Mental Health Task Force website or the email address to sign up for those. Reminder that this is an environmental and chemical free environment. So if you're not chemically free, there are no showers. Next time, please abide by that. And we do have reasonable accommodations. So the briefing agenda, you have that, you were given that when you came in. So we'll get going with that right away. And it is my pleasure to welcome County Executive David Crowley with the opening remarks and his comments as to the budget. David.
Good afternoon, everybody.
Good afternoon.
Awesome. So thank you so much, Mary, Christine, and the entire task force, not only for the invitation, but this opportunity to speak with you all this afternoon, but for the crucial work that you do on a consistent basis and for your dedicated service. And so I'm going to speak and open it up for questions, and then I'm going to introduce our budget director to do what he does best. So your advocacy and your determination to ensuring the quality and impacts of our services for residents in need of mental health and substance use disorders support is not only valued, but it's extremely critical for the entirety of Milwaukee County. And so today you're going to hear an overview of the Milwaukee County budget process from our Office of Strategy, Budget, and Performance, along with several other county leaders with proposed department budgets as well. And so I want to welcome everyone to please engage, please ask questions, but also please offer your ideas. In the past, I know many of you heard me sounding the alarm, particularly to this group, on the dark financial forecast facing Milwaukee County, and really called on this group to help us advocate for the state and giving us the tools needed to generate more revenue and continue funding critical services. And for the first time as county executive, I'm pleased to deliver a new message. And that is Milwaukee County finally has the financial tools it needs to right the ship, avoid major cuts to services, and set up future leaders for success. And I'm very grateful that we've had the support of the Mental Health Task Force throughout this process. And so I again want to say thank you for your advocacy and your continued commitment to strengthening Milwaukee County on an everyday basis. And one of my constituents from day one has been to value, one of my commitments from day one has been to value our fiscal responsibility and make sure that we all continue to serve our residents far into the future. And so Milwaukee County, we now have a lifeline that it needs to get our financial house really in order and continue to advance our strategic plan to achieve both race and health equity in the county. And so to that end, we are extremely proud to see that the new Mental Health Emergency Center and the Behavior Health Services redesign entering its first full year of its operations. And the redesign process included an analysis of zip codes data, proximity to local hospitals in the downtown area, as well as access to DHHS services. And it really shed light on the challenges Milwaukee County residents face when it comes down to accessing behavioral health services that were closer to where they actually live. And so this new facility will be in proximity to where 70% of the patients that are currently served live around or in. So this is another milestone that we've accomplished this year. And what it really did is it was about, putting this historic opioid settlement dollars to work. And we wanted to do this right away, particularly in the community, to make sure that we could prevent deaths and really help residents on their road to recovery. just left a press conference and we've announced that we've installed 11 harm reduction vending machines all across Milwaukee County neighborhoods, particularly with the greatest need, based on the data that is available to us. So I'm very optimistic that these machines will help our community immensely in the face of the opioid epidemic. Because honestly, when we have the resources, we can do amazing things to really serve our residents. And in order to continue doing so, we need to make sure that we have a sustainable revenue source to make those important investments that will improve quality of life all throughout Milwaukee County. And so I do want, again, I got to leave at 4 o'clock for another commitment, but I do want to open it up to any questions that folks may have before I invite them.
Thanks. Hi, I'm Windsor Ralsted. I'm an attorney at Disability Rights Wisconsin, and thanks for your time. So with the opening of the mental health emergency center, from my understanding, there's room for 120 individuals, but because of staffing and funding, only between 20 to 30 beds are occupied based on staffing limitations. So could you elaborate, like, is there any projection of increasing caregivers or funding so we can put more individuals in those beds?
Absolutely. Great question. So, you know, while we were fighting for the local option sales tax, one of the things I would talk about was that people forgot when we had a behavioral health system that actually worked and we didn't have, you know, wait lists and people can get access to that care. And so for us, we know that there's an issue when it comes down to the workforce. And so Milwaukee County, you know, we've instituted a change makers program to really bring individuals in because we want to be an employer of choice. And so whether we're talking about the benefits that we've put in place, for example, paid parental leave to be able to take time off to care for a child or to grieve for a lost child, we want to be able to put those things in place. And so we're continuing doing that. And I would say that these dollars are going to allow us to really invest in increasing that workforce. And so we know that we're in competition with many other places when you think about where we are in general, because this is a candidate's market. But it is our goal as Milwaukee County to do as much recruitment as possible. But I also want to make sure I let you know that we want to make sure that we can retain the employees that we also have employed at the same time.
I believe there was a miscommunication. Were you talking about Granite Hills Hospital?
They're related. Yeah.
Okay.
Executive Crowley, I could add that on September 5th, Granite Hills will add 12 more beds. So they'll be at 36 adults and 10 kids.
Repeat that again for the people on Zoom.
Yeah, so the Granite Hills Hospital has plans to expand by 12 patients in their capacity on September 5th. They've recently hired a new chief medical officer, Dr. Brandy Jackson. I met with Dr. Jackson right before coming here. I think the community is going to be very excited about her knowledge and experience that she brings to us from the Chicago area. And that enabled them to begin to expand. That was their biggest challenge, was a physician and then some nurse staffing. So we're on a path for enough, and we've been making it work. But we're on a path for a significant expansion very soon.
Thank you. Any other questions folks may have? All right, well, I'm sorry.
No worries. First of all, County Executive, thank you so much for your work to bring in additional revenue so Milwaukee County has the ability to sustain vital services. One of the service areas that's really important to many people with disabilities, including people with mental health needs, are transportation services, because so many people are non-drivers. In fact, 30% of people in Wisconsin are non-drivers. And if you don't drive and you need transportation, that's vital, like getting to work, getting to healthcare, accessing basic needs. And I know it was tough in the last budget to have to look at cutting a program, the paratransit taxi service. that is important to a lot of people with disabilities. And, just looking forward, I wonder if you have any ideas about how we can all work together to expand funding and have a dedicated funding source for transit instead of being in a position that we've been in where we have death by 1,000 cuts. So,
Absolutely. I know ATU appreciate that question as well. But we want to make sure that we can preserve, our Milwaukee County transit system. And one of the examples that I would use is that this is about preserving our transit system, right? When we think about the local option sales tax, if we had to cut our Milwaukee County transit system, there are able-bodied people who could call a Lyft, who could call an Uber, but there are folks with disabilities who can't do that exact same thing. And so when we're talking about 40 cents on every $100 of taxable goods, right, to make sure that we have a transit system going, just imagine if we had to cut half our routes. Because if somebody who is able-bodied even had to catch an Uber or catch a Lyft to work, we're talking about a $46 impact for somebody making about $16,000 or less with the sales tax. If we didn't have any transit, that impact will be even greater, a huge burden on many individuals. And so we have to continue to expand the partnership that we have at the state level and expand the partnership that we have at the federal level to make sure that we have dedicated funding. But I would also say that we all have a hand in making sure that we create a culture of ridership right here within southeastern Wisconsin at the same time. And so this is not just going to be Milwaukee County being on the forefront, making sure that we preserve our transit. We need everybody singing from the same hymn and helping other folks understand how vital this particular amenity is. We love our parks. We love our transit system. Those are two of the biggest used amenities that we have, and we have to make sure that we can preserve them. So great question.
Yes, I've got a question, comment. From the perspective of aging, I had talked about initiating an older adult peer specialist program, and I've taken that vision a bit further and with what the peer specialist could do, because we really need to look at the substance abuse of older adults with prescription drugs and alcohol, because there is a high propensity of prescription drug abuse or abuse with narcotics with older adults, if you look at the literature. And I think that's a way that we could use peer specialists and alcohol, because that leads to the depression during the isolation. So I think Milwaukee could be very, very creative and on the cutting edge to look at that and be able to invest some dollars. And you could potentially use opiate dollars for that, because it's very often in homes where opiates are being distributed in cases of older adults. So I just put that forth.
I appreciate that. I know you're advocating for this also at the state level, and we need to make sure that we continue to advocate to make sure it's properly resourced. Because at the end of the day, we can provide people some help, but sometimes having an individual who's been through the same exact thing that you have been through and being able to talk to that individual could be even more helpful. So I appreciate that.
Mine would be, oh, God. Mine would, I've been hearing you talk a lot. But mine is on our violence here in Milwaukee with people, and people like myself with intellectual, and my friends don't want to go outside because they're scared to. There's crime all over, even where I live. And I thought our neighborhood is safe, but it's safe to a point. What are you going to do? People are now isolated again, not through only COVID is gone. Now we have to be scared to take out the garbage. You're scared to go to activities. I missed a lot of activities this summer because I'm afraid to be out after a certain time. And my friends are the same way. They'll call me and say, what are you going to, we're not always asked. People with disability, they're not asked what we think. We've just heard about crime and shootings and all this, but how can we be involved in trying to help too? And so we're not afraid to go out. I'm a very social person, but I'm also scared to go out too now. At 7 o'clock, I'm back in the house unless I'm with somebody. is because I love the festivals. I missed a lot of them because of you just don't, and I don't hear you talking about that. I hear you talking about crime, but I don't hear you talking about, I guess we don't talk to you enough, people with disabilities, and I think sometimes you need to pay more attention to people like myself too, so we can talk to you. And we're not gonna just call you and complain, but we don't know what to do either to stop being scared. Now the COVID's over and we're still isolated because we can't go out. We're scared. So thank you.
Thank you so much for that, Cindy. And I know that you're a pretty enthusiastic person, so I appreciate that. And you're right, but at the county level, we're not just trying to treat the symptoms, right? When we think about what happens once an individual comes into our custody, but it's also about how do we address these root causes to make sure people aren't coming into our doors in the first place. And so when you think about the local option sales tax, right? We have a program called the Credible Messengers Program that works with young people who have been involved in the justice system. More than 75% of the young people that went through that program have not reoffended. And so when we have the ability to expand on programs like that, it gives us the opportunity to address root causes, give those young people the support, but also wrap around other services and support systems around the families as well, so they are in a better place to help out their family members at the same time. But when it comes down to the violence, this is something that we all have to tackle.
Okay.
And so one of the things that we did, and this is the second year, was we did the Healthy County Challenge. And the reason why we did the Healthy County Challenge, yes, it's a great way to trick people to be along with my fitness journey. But really, it was about how do we utilize our parks and activate our parks to make sure that they are safe spaces and places for everybody to enjoy. And so the more and more people we can get those parks activated, the more we provide a safe space and a safe environment for folks. And so we want to continue to build upon initiatives like that, but it's going to take partnerships. So whether we're working with, the city of Milwaukee, MPD, the sheriff's office, and many of our external stakeholders that we contract with, we're all at the table. And so we're going to continue to have these conversations, but I think everybody in this room that when it comes down to tackling many of the issues that we see facing our community, which is not unique in Milwaukee, it's going to take some time. It's going to take all hands on deck.
Okay, I like what you said. Thank you.
Thank you.
Just a comment too, Miss Cindy. There are an abundance of resources that are taking place, and I want to encourage you. Look at me real quick. Don't be afraid to go outside.
Right now, because
I've spent this entire summer at the Milwaukee County Parks. Sometimes on a Monday, reaching 85 boys before they play basketball. We bring food, we provide resources, whether it be for domestic disputes, reckless driving, and things like that. So sometimes the news chooses certain narratives, and that's why it's important for us to own the media and also get out here in the community. At Atkinson Park, the majority of families that we serve are ages 46 to 58 years old. And then at other parks like the Tot Lot, you might have a 3-year-old, a 7-year-old. So some of those things don't get the same level of coverage. So come outside. You can meet me at the park. You're gonna be all right.
thank you.
Love you.
All
You
right.
too. All right, I'm not gonna age myself.
But I appreciate the questions, the comments, and the concerns that folks may have. Do we have any other questions? All right. So thank you again for allowing me to be here. And so now I would like to introduce you all to Joe Lamers, who is the director of Milwaukee County's Office of Strategy, Budget, and Performance. And he's going to provide you a deeper look into our budget as well as the process. So thank you again, and help me welcome Director Joe Lamers.
All right, good afternoon, everybody.
There you go.
As mentioned, my name is Joe Lamers. I'm the Director of Milwaukee County Office of Strategy, Budget, and Performance. And I'm going to just share some details with you regarding Milwaukee County's overall budget and our outlook for the upcoming fiscal year. Not sure we run these slides, but we could go to the start of the presentation. Okay. Oh, I got control. Okay, thank you. It's perfect. All right, I'm running it. Wonderful. All right, so just in terms of Milwaukee County overall, we have a budget last year that's around $1.3 billion. One thing in the context of Milwaukee County's budget that's always important to know is we are operating many programs that are required by state mandates. So, for example, our jail, our mental health programs, our youth correction programming. A lot of these programs are required by the state of Wisconsin, and we're fulfilling a state mandate in providing those services on behalf of the state. We do have some services that are not mandated, but we are the responsible party for managing, for example, our parks, as well as we operate the transit system at Milwaukee County. So our 2024 fiscal outlook, I'm happy to say we actually have a surplus projection in our budget next year, which is the first time we've been able to be in this position in over 20 years at Milwaukee County. I've been here before talking about our budget, and what we've often referred to as a structural deficit is what we've been operating with for many years. We still have financing issues at Milwaukee County, but the surplus that we're seeing in place now is a direct result of the sales tax that was just recently approved by our county board and county executive. And I'll talk a little bit about the sales tax. We do have a surplus, but we also have a lot of needs to be addressed at Milwaukee County. And we also want to take a look at the property taxes in Milwaukee County at the same time. And I will note the surplus is not necessarily expected to be permanent because we still have funding issues at the state level. But we'll talk a little bit more about that. So in terms of Milwaukee County's revenues, this is where our budget is funded from. So our largest local revenue collection is the property tax, 313 million. We brought in about 100 million of sales tax this year. That number will go up next year. And then we have state and federal revenues that comprise a significant portion of our budget. And the green section on that chart is direct revenues that departments collect, $385 million in revenues, such as the airport generates all of their own revenue to fund their own services. Same thing can be said for the zoo. And within health and human services and transit, there are a lot of state and federal revenues helping to fund those programs. And then in terms of expenditures and what programs Milwaukee County offers, health and human services is becoming by far our largest service area, $408 million budget this year. That includes our mental health services, as well as our programs in health and human services, housing, aging, youth corrections, and other programs related to human services. Our next largest area is transportation, with our bus system, our airport, our highway patrol, and we have a variety of other programs at Milwaukee County, including operating the parks department. Over 150 parks are in the county, managed by the Milwaukee County Parks Department. We also run the court system at Milwaukee County, so that makes up about 5% of the budget. And public safety, including our sheriff's department, our community reintegration center, emergency management, makes up about 134 million, or 11% of our budget. So I just wanted to share some information about the programs and services that the county offers and how they're funded. I want to talk about Act 12. This is the state legislation that provided the county with the option to increase its local sales tax collection. So it was approved by the state legislature just this year. This was an effort that Milwaukee County had worked towards for many years, and the state just provided this option for Milwaukee County to increase its sales tax rate by 0.4%. It required an approval of our Milwaukee County board and county executive. That board just passed that last month, and the county executive signed that this last week, and that becomes effective beginning in 2024 and brings in $82 million of revenue is estimated in 2024. The law specifies that the new sales tax revenue has to be used to pay off our unfunded pension liabilities at Milwaukee County. Some of you may be familiar, we have a long history with our pension system that has led to some very high cost increases
What this does, it puts us on a trajectory to pay off our pension system, move to the state's pension. And by doing that, it also frees up some tax levy funding that was previously used for the pension to help offset our structural deficit that I'll talk about. Also with Act 12, there's a number of other items in there. For Milwaukee County, we're expecting to receive an additional $7.6 million in shared revenue next year. And in future years, our shared revenue payment will grow by inflation. That's the significance of that is shared revenue is an important source of funds in our budget. It's actually been flat and reduced by the state for the last 20 to 30 years. So this is the first increase we've seen in that long time, and also provides us some assurance that it will grow in the future with inflation. The transition to the Wisconsin retirement system, I just wanted to note the significance of this. Milwaukee County back in the year 2000, at that time, policymakers provided a series of pension benefits to employees that were highly excessive. The benefits were taken away for employees going forward, but they remained a legal property right for employees who were on board at the county in early 2000 were still required to pay the pensions, including for employees, for example, of the old behavioral health hospital, which were many employees at the time. And it's a legal obligation, but we're actually moving away from our county pension system that has this large unfunded liability, $760 million. We're going to move on to the state's retirement system. So all new employees will go to the state beginning in 2025. Notably, with the Wisconsin retirement system is considered one of the best managed pension plans in the entire country. So they don't have an unfunded liability in their plan. They have financial plans and policies in place that help them be sustainable in the future. And this was sort of meeting another goal of the county within Act 12 by moving towards that WRS system. So there's a chart here that shows the structural deficit for Milwaukee County. So like I mentioned, we've been operating with a structural budget gap for over 20 years, and ties to the pension, and it ties to the revenue streams that the state allows us to collect in limited growth that we get on our state aids. But we were projecting prior to Act 12, we projected an $18 million deficit in year 2024. And when we look out over the next 5 years, we're projecting that to grow to 109 million by 2028. Our new projection with the approval of the sales tax and other items in Act 12, we have a $31 million surplus going into the next budget year. We still have a budget gap and a structural issue in the future, but it's dramatically less. In 2028, our gap is $73 million less than it otherwise would have been. It's at 36 million. We think that that's far more manageable than the 109 million. Obviously, we still have issues to work through in future state budgets and legislative cycles, but we were previously looking at a position where we would have had to have removed tax levy from non-mandated services and further make cuts to our mandated programs by as much as 20%. We're not seeing the need to do that at this point in time. So really is helping to preserve services by having a much lower structural deficit. So, having the funds available is a somewhat new position for the county. And we're having to take a look, at where are these funds going to be directed. We have a lot of different needs. One of the priority areas that's already been mentioned is transit. It's been known and broadly shared that our transit system has been relying on federal COVID relief dollars that were provided to transit systems nationwide to make up for lost revenue, passenger fares, and cost increases. Those funds are projected to run out next year. And the transit system, actually in 2025, transit system alone was projecting a gap of $25 million, which could have had really significant system impacts. We are looking at, dedicating some of the new freed up tax levy to transit to help prevent that from happening in the near term future. Parks budget, they have massive deferred maintenance in their budget. They've seen a lot of reductions over the years because of our structural deficit. Parks used to have over 1,000 employees to maintain those 150 parks. They now have about 250. So there's pretty much the same footprint, but like 1/4 the staff. So we have backlog issues in our court system. We have a lot of needs also in public safety and public health, as was mentioned here. So, you know, we're looking at those issues as well as high vacancy rates in our workforce, which can, I mean, we talked about vacancies in the mental health hospital, but those may be private positions, but also in our county staff, there's a lot of vacancies. And that's an issue across the county. So there's really a lot of needs to be addressed. $31 million is not going to cover them all, but it's at least going to put us in a position where we're not starting our year looking at making further cuts, and we can make some priority investments. We can also look at our capital infrastructure needs, where we have about $1 billion backlog of building maintenance. And we also have the opportunity to take a look at our property tax and potentially provide some property tax reduction in our upcoming budget. We recognize that the property taxes in Wisconsin and Milwaukee County are quite high. And with a diversified revenue stream increasing our sales tax, we may see some opportunity to drop our property tax charge. I'll note that Milwaukee County's share of the property tax is about 17%. So if we reduce our property tax, an individual's property tax bill still also depends on what the city does, the school district, and all the other taxing entities. But we have an opportunity for the upcoming year to, you know, take a look at where our property tax levy will be. There's limits on what we can charge for property tax already, basically new construction and bonding, but we will be looking at that for the upcoming year. So the annual budget process, this is our timeline for a budget. Right now, in July, we had received the request from all of the departments. So we're reviewing those requests right now. The county executive will be holding 4 town hall community meetings over the course of the upcoming weeks. And the county board will receive the recommended budget from the county exec by October 1st. And they will hold another number of meetings with their finance committees where they take public input, review budgets with departments, and then ultimately the county board will review the budget in November and adopt a budget for 2024. All right, so those were the comments I had to share. And if there's any questions, I could take them now.
I have a question. You hear me?
Yes.
Yeah, nice job, Jill. What's driving that? You go from, I think, a surplus at 24, perhaps a smaller in 25, to deficits thereafter. So what are the major drivers that are causing this to occur?
The driver is pretty simple. We still have a structural revenue issue at Milwaukee County where our revenues that we're allowed to collect are not even expected to be at the level of inflation. So our property tax is our #1 source of revenue at Milwaukee County. And by state law, we can only increase our property tax by a formula that's based on new construction. And it tends to be about 1% per year. So for 2024, we just saw a preview of the number, it's 1.2%. So even if you look at inflation being a simple 2.5%, our largest revenue source doesn't keep up with it. We also receive state aids for transit, human services, transportation, and they have not kept up with inflation. They've actually been flat for many years. So we still expect, when we look out 5 years, we're not projecting growth in those revenue sources because we haven't seen, we saw the movement on the shared revenue, but we haven't seen movement on basic community aids, which fund human services. Transit aids saw a growth in the state budget, but it was like 1% a year, I believe. Our revenue sources by state law are still not allowed to keep up with inflation. So that's really what's driving the structural deficit going forward. The one bright news on that is when we look at our structural gap year over year, we're expecting it to be about 13 million. In the past, it was typically 20 to 30. So with the shared revenue growth, the pension no longer affecting our structural deficit, it's less than it used to be, but we still have work to do with state revenue reform in terms of we see better growth in these revenue sources, or else this structural deficit will continue to come back to us.
Thank you.
I'm just gonna check this.
Check. Thank you for the information. I just had a question, and I apologize if I'm missing some information, but with the 0.4 increase on the tax levy, that's correct?
Correct.
You said a lot of that was going to repairing the promised pensions. What percentage is going towards those pensions, and what percentage is going towards the parks and other programs that have been in a structural deficit?
Right. So by state law, 100% of the sales tax is going to the pension. So it's going to make our annual required payment to what's called our unfunded liability. We're $760 million in the hole on our pension system. And the first payment has to go to that. If there's any remaining after that, it can go to a pension obligation bond, which is another pension cost that the county has from a debt it took on in 2009. So all of that goes to the pension. That's what's written out in the state law. And what the sales tax is actually to retire after either 30 years or when our unfunded liability is paid off. The reason we actually see an improvement in our structural deficit is because it's written into the state law that the amount that we spend on the unfunded liability is now freed up, and we can use that for other purposes. So the amount that we spent on the unfunded liability last year was $50 million, approximately 50 million. So that is the amount that's available for county services. So that's kind of why our budget gap went from -18 to +30 because of the $50 million property tax redirection that's allowed in the law.
We got a few. We got Robin and someone else. Quick question. Is MCTS generating revenue right now?
Yes, majority of the MCTS budget is funded either by affairs or state and federal revenues. There's also a vehicle registration fee that gets collected. Almost all of that goes to transit operations. So those are all revenue sources for transit. And then once those revenues are all used up, if there's any additional costs, it has to be paid for with the property tax. So that's where, there's going to be fewer federal revenues in 2025 for transit because the pandemic relief funds are going to run out. So that's why they will be more heavily reliant on property tax. And if the property tax is not available, then, and there's no other solution, then we won't have funding to sustain the transit system.
Here's a free one. There's some great campaigns that's going on right now. I saw a Ride MCTS billboard coming in.
Right.
But working with young people, I'm finding out that they don't know how to ride the bus.
Right.
So there's a bridge that goes from 8th grade into 9th grade where we talk about how do you enter into high school? Maybe if we have conversations with public school councils that we can start weaving in transportation. Because for me, I get a Cash App request 4 times a week from one of my mentees saying, hey, can you get me a Lyft or Uber? And I'm like, get on the bus.
Yeah.
And I'm finding out they don't know how. They don't know how to go to ride.mtcs.com and just pick up the schedule. But if we bake that into the school system, I think it'll be a great opportunity.
I had to get on the bus.
I have a quick question about the hop.
Right.
We get, does the county pay for? towards the hop
No,
or
the streetcar is run by the city. So the county runs the bus system. We have no management of the streetcar.
So right now, if I understand correctly, it's still free.
Yes, I believe that's correct.
Why don't they start charging?
They have, I'm not an expert to speak to this, but they have external sources. that are-
Potawatomi is paying for the year.
Exactly. So private businesses are paying for that.
Private, okay.
Yep.
That's what I did.
I have a follow-up transit question. How concerned are you that the legislature changed the mechanism for funding transit and put it into the GPR revenue?
Right. I would share concerns about that, because it's competing now, but we have to continue to advocate for transit funds. Transit themselves have done a huge effort to educate on their bus system, you know, and the gaps they're facing. I think, you know, these types of lobbies, there's all different kinds of lobbying that took place. I think these types of things all helped contributed to legislative agreement to provide some revenue relief to Milwaukee County, directly or indirectly. It's a fair concern, and something we just have to continue to educate people on the need for transit funding. Not only that, but also increased funding, because as you can see with the structural deficit, it comes back. And we haven't seen increases significantly in transit aid for so long. So yeah, that's a good flag.
Questions for Joe?
I just have one
Microphone?
on the pension. I'm not understanding about the pension. I never heard about it, but is this from a long time ago or it's been an ongoing thing?
Yeah, so Milwaukee County provided all these large benefits. They were approved by policymakers in around the year 2000.
Okay,
There was, you know, not in my opinion, not extensive enough of fiscal
Okay.
review to say
Yeah.
what the true cost is gonna be. That started being realized after it was already approved. The county took away the added benefits that were provided. Our pension system for current Milwaukee County employees is no longer considered generous compared to other pension plans. But when you look back on the benefits that were provided, they're called backdrop, the buyback, the rule of 75. They added to the county's unfunded liability, which is resulting in us paying more than $100 million a year towards the pension. The majority of that cost ties to that unfunded liability, which traces back to the benefits that were provided. But they're not, the important thing, they're not available anymore to county employees. And
okay.
we're taking steps to pay off the debt that exists.
And so what do you call it? It's gonna, so how long do you have? You said it's gone now? I mean-
Well, we now have a dedicated revenue source.
Okay.
for it, Whereas in the past, we had to pay for it with our property tax levy. And every time the property tax levy went up for the pension, we had to cut services to pay for the pension.
Oh,
Now we have a dedicated revenue source, so it's not the same situation.
yeah,
We have some estimates on how long it will take, and we're estimating it could be 15 years for the pension liability to be paid off.
thank you. I understand it better now.
Thank you.
Wow. 15 years a long time.
Thank you.
We're going to move on to the Milwaukee County Transit System, and I'd like to introduce Jim Hosch, the Chief Financial Officer, and Sandy Kellner, the Chief Administrative Officer. Our transit, there's Jim. Sandy joining you? Here.
She's seated.
Okay, great, thank you.
Good afternoon. Again, my name is Tim Hosch. I'm the CFO for the Milwaukee Transit System. Just want to go over some highlights of our 2024 budget. At a high level, our focus this year will be on the major projects that we have going. So to start with, we will have our first full year of the East-West BRT system and our Wisco fare collection system. So a lot of effort will be placed on monitoring those and making small improvements as necessary during the first full year of operations. We also have North-South BRT, the engineering, design, and environmental review will continue for that project as we look towards submitting a grant and trying to get funding to get a North-South BRT in place in the coming years. We will continue our public education on the fiscal cliff, our Save the Bus campaign. 2024 does reflect the final use of our COVID relief funds. So that creates a structural deficit of about $21 million for 2025. So important that we continue to emphasize the need for funding. And thank you, Joe, for your comments earlier about how sales tax will impact that. Last but not least, we look to stabilize our paratransit service under a single provider. That will be implemented later this year. In addition to that, we are looking to implement a number of customer-facing improvements, including an interactive voice response system for the paratransit service. Now to delve a little bit into the services themselves. On the paratransit side, our van service will continue as border to border for Milwaukee County, so no changes there. We mentioned the consolidated vendor, and the base fare remains the same, so it is $4. We are making a change, however, to the agency fare that is going from $20 to $35, and that is for managed care organizations. This is part of a general plan to increase the cost to MCTOs to the full cost for those services, as the MCOs have funding for transportation. And lastly, the taxi service will be ending this year, as we've previously discussed, and we'll be working to transition those riders to the van service or other appropriate alternatives. On the fixed route side, no fare increases there as well. In fact, the new Wisco system does provide actually lower average costs through its fare capping mechanism. So if you haven't gotten a Wisco card, consider using that. You pay per ride, and we cap out at the old daily, weekly, and monthly pass rates. So your average cost per ride is actually quite a bit lower in paying through that system. Some changes to the cards. The Go Pass is gone, but in name only. We're just migrating that over to the reduced fare card. The prices and costs are all the same. It's just a different card. Similarly, with paratransit riders who ride the bus, they used to use their Transit Plus cards. You need to migrate those clients to a reduced fare card. But again, the costs are exactly the same. The program is the same, just a change in card. So 100% of the service that you have now will be in place for 2024. We piloted bringing back the Summerfest service with 2 routes this past year, and we're looking to do that again next year and possibly expanding it to a 3rd route. Some organizational priorities for us in 2023. Obviously, the structural deficit for the following year is critical to us. So we continue to work on that with the county. Some capital improvements that we have put in requests for this coming year, 30 new buses, some significant investments in safety and accessibility. We're looking at doing curb extensions, bus pads, and some bollards. All this is around our passenger stations for greater accessibility and safety. And last but not least, a maintenance software system for the maintenance of our facilities and buses. So those all go to the capital improvement committee for review, but certainly those are high on our priority list for next year, and hope we get a positive response. Lastly, bus operator recruitment continues to be a large priority for us. Retention and training of our operators is critical to us as we have regular turnover in those 700 positions. In closing, we want to just state that a strong transit network supports Milwaukee County's vision of becoming the healthiest county in Wisconsin. We feel that transit is an economic engine for the area, so investments in an inclusive and accessible transit network ensure a future where an individual's race or ability no longer predicts one's success. So the sustainability of transit in the long term is, however, dependent on funding. So we appreciate everyone's support as we look towards the future, the Save the Bus campaign, and the impact of the sales tax. There are some references here if you want to go online and get some more information on the VRT or some of the other things I talked about. And Sandy and I are also available here for questions.
Thank you. My name is Kevin Fetch. I'm the director with Lutheran Social Services Connections, which is an Iris consultant agency. I assume the MCO rates apply to Iris as well.
Correct.
Okay.
Can you repeat his question?
Do the MCO rates for paratransit apply to Iris agencies? And the answer was yes.
And then the follow-up is that 35 a hard number? Because our funding is different than the MCOs and we may have to ask for additional funding from the state to cover the increases in plans effective January 1st. So that 35 is a hard number?
Yeah, that
We
is.
start, we want to start that process early, obviously.
Yeah, that is the number.
Okay, thank you.
Of those 30 new buses, how many are e-buses and are those a lot cheaper than regular buses?
The 30 buses would be diesel, and they are about half the price of the electric buses.
Okay.
Question?
Yes, I do.
Good, go ahead, Cindy.
So, I know you did a lot of changes to the buses. One thing you didn't, there's one thing that I'm not happy about is that you put the electric buses downtown. And then you have to, I mean, seriously, you can't even get to. I mean, I live on the 14 and the 68. I take the 14 in Bay Shore, then I have to, go down and then if I want to take another, we don't know where the rest of these, the bus to Southbridge, don't know where to get that. Second thing, right there at Bay Shore, I went to take the bus the other day and the shelter's gone. All the shelters seem to be disappearing on a hot day and whatever. We're not asked about this stuff. I don't mind taking the bus. I don't mind taking the van service, but we're not asked. You took off places where we used to connect. I realize about I don't understand it very well, but why are the shelters disappearing? And where you ask the bus driver where you get the Southbridge bus, they just look at you sometimes like we're crazy. I haven't really found the bus downtown where you can get it. I used to just take the 14 all the way to Southbridge or wherever I wanted. Now you gotta go on 3 or 4 buses in the middle of the winter. Who wants to do that in the night? I'm not saying I'm unhappy with you, but a person that can't see very well or can't walk very well, how you expect them to get to point A to point B? So I think downtown has changed for the worse in a nice way. Not so much in the Bay Shore area. No, I can still get the 14, but I can't find out where to connect with the rest of the buses. And my friends either, because my friend called me and says, you know, they're taking all the shelters away. I had no idea about that, so thank you. I'm not trying to be mean about it.
No, Cindy, let him answer.
We appreciate the feedback.
That's
There isn't an intent to remove shelters in general. We have had to move some around with the rerouting with MCTS Next and the VRT. We do have a customer service line that can help you find the correct routes, and we actually have some travel trainers that might be willing to meet with you. Even
That might be helpful for, I mean, I've been thinking the bus for years, but I'm talking about the shelter. I mean, right across the street from Trader Joe's, it's gone. Completely on a hot day, and you're trying to wait for the 68 is the slowest bus on our routes, and you're burning up, and there's no shelter there. I'm just gonna say that nicely.
Yeah.
I'm sorry.
And our shelters have been vandalized and hit with cars. Oftentimes we have to replace them, and we do intend to bring them back.
Okay.
Again, I'm leaving my card if you want to talk about maybe a travel trainer or get some specific information from our.
Yeah, I mean, it won't only be for me, but I think, people that take the bus in general over there, I'll give you a call. I'm the director of People First, and my thing is to make sure not only me can get around the city of Milwaukee, but my members. So thank you.
A question right here. He's got the mic.
Hi, my name is Kyle Handel. I'm an
Moment,
executive.
just for a second, Kyle. For all of our presenters, people in the room that are talking, there's about 34 people that are joining us virtually. We thank you to Independence First and our sign language interpreters. Please make sure when you grab the mic, you speak directly into it. They've put a few comments in the chat, so that's for our commentators as well as the folks with questions. Thank you.
My name is Kyle Handel. I'm the executive board member for HEU Local 998. We represent the mechanics and bus drivers from Milwaukee County Transit. Miss Cindy, she mentioned that some people feel unsafe because of the crime and violence in Milwaukee. I think that's concern we've heard echoed by bus operators who are often afraid to go to work every day. We have been advocating for an increase in security funding. I didn't really see that as one of your organizational priorities. And what is your requested budget line item for security for Milwaukee County Transit? Thank you.
The security budget is 2.1 million, and I do know there's a security task force working on how to best spend that. And that's about all the information I have on that.
Hi.
You press the button.
Yep, okay. I have a question, if not you, then who? I know Cindy talked about the warmer months, but my question is about snow removal, so people can get to the bus stops themselves. So is that part of this project? Is it someone else? Is it customer service? I mean, who are the eyes and ears on snow removal?
I don't have the answer to that question. Sandy, is it our responsibility within the filter, or should we get back to them?
Well, in general, it's the municipality's responsibility, but there are some direct specific like park ride lots and some shelters that we have responsibility for. But I know that there have been, thank you. I know that there have been efforts in particular over the past few years to try to elevate the issue because exactly what you're talking about, that as much as there are a lot of there's a lot of shoveling going on, it's not always constant, but that's definitely something that we can continue conversations on finding solutions.
Where are you from? Where's she from?
Sandy is with Milwaukee County Transit System. She's with me. So for those of you online, just to clarify that thing, it sounds like it's the municipality's responsibility for clearing of snow, but again, we are looking at some other options. I know with the newer stations like on BRT, we've put in heated walkways so that the snow melts and that the shoveling isn't necessary. So as we do make improvements, we look to, resolve some of those older issues where we can't get the cooperation of the local municipalities. But it is as it develops with new projects. Question over here.
Just following up on Christine's question, were electric vehicles considered, and did you do a cost benefit analysis of like multiple years of operations versus the initial capital outlay?
We're still in the process of evaluating our electric fleet. So we haven't even received our first full fleet. We had ordered 14 buses. I think we currently have 8. So we'd like to get a year under our belt before we evaluate whether or not we're going to expand that fleet. We are very interested in it, I would say. But again, they are double the price. So we need just a little bit more time to evaluate that. On a positive note, in terms of costs, we do have some grants coming in that would help to cover those costs from the feds. There's often a 20% match on those. But again, there are some opportunities coming. Again, need a little bit more time for that evaluation.
This is Barbara Beckert. I wanted to say how relieved I am to see that the border-to-border paratransit service is being continued or in your proposed budget. I know there was a lot of concern when there was uncertainty about the funding for the sales tax. And I just hope that going forward, we can, the disability community can work with the county to find more options for funding. A lot of people are going to really be, their independence will be restricted by the loss of the paratransit taxi service. And so it really is a loss for people. And I hope that we can, have a future someday where we're adding services instead of taking them away. And, you mentioned federal funding, maybe there are opportunities to work on additional funding sources to add that capacity in the future. So just wanted to keep those ideas of looking at other models for enhancing funding out there and the need to expand services because so many people are in transportation deserts right now. Thank you.
Yeah, thank you for that. We share your concerns, doesn't bring us any joy to cut service, so we are equally as glad to maintain border to border. Question over here.
Thank you for being here today. I have some questions in regards to the investment in safety and accessibility for curb extensions, bus pads, and bollards. Will the disabled community be a part of that discussion as they are for the East-West VRT? I know a lot of people say, oh, engineers and architects, they're working on it, but they're not persons with disabilities that understand how the design can affect a person with disabilities. And so I would like to ask that and, when we can possibly hear when the disabled community could be a part of that.
Yeah, thank you for that. It's very early in the process, so I will pass that on to the project managers for that and try and make sure that we include the disability community in those planning processes. So thank you for sharing. Thank you.
Now we'll move on to our largest group, Milwaukee County Health and Human Services, including Aging and Disability Services, Behavioral Health, Children and Youth and Families, Housing and Veteran Services. And representing that group today and accepting the academy will be LaGrant-McClain, Executive Director. Is David Muhammed here? Okay, not David Muhammed. And Matt Fortman, the Chief Executive Officer. Thank you.
Good afternoon, everyone.
Good afternoon.
And happy Tuesday. So thank you all. You can go ahead and move to the next slide. And we like to start off with our mission and our vision. And that is together creating healthy communities, which means not just Department of Health and Human Services, but as a county, as community providers, as faith-based communities, as businesses, as schools, that we all come together to take on that charge and to take on that responsibility. And so there are a number of service areas, as you see, that are under the umbrella of Department of Health and Human Services. So Aging and Disability Services, our Children, Youth and Family Services, Behavioral Health, Housing, Management Services, and Veteran Services. There are a lot of services. And many people may ask us, how do we make sure that we do not lose sight of that everyone is important and that we can prioritize that? And I can tell you that if we think about the strategies for Milwaukee County as a whole, it is intentional inclusion. And that means that each and every day that we get up, we are intentional. It is, as you will see in this budget that our Chief Financial Officer will present, is that we were intentional. And even though it was a difficult budget, we had to make some tough decisions. We also said that we wanted to prioritize mental health, that we wanted to prioritize Aging and Disability, Veteran Services, our Children, Youth and Family Services, and Mental Health Services. And so we did our best to do that. You can move to the next slide. And we did that because we focused on, many of you have saw our strategic plan, our 2020 to 2025 strategic plan that focuses on 2 strategies. And that definitely aligns to the overall strategy and vision of Milwaukee County as a whole. Through racial equity, we become the healthiest county. And so our first strategy is all around no wrong door. It's about access. It's how do we place the person, no matter who they are, no matter what their age, their race, their social economic background, that we place them at the center. And then we began to wrap services around them. And then our second strategy is all about the policy and the system change. And I always tell staff that we are a part of a system. Absolutely, right? We did not create some of the statutes or the processes or things that are in place, but it's our job to advocate. It is our job to figure out where are the barriers and why are there disparities and how do we advocate to make changes? And we know that those changes do not happen overnight, but we will continue to wake up every day and be intentional in changing those. So now I'm going to bring up our Chief Financial Officer, Matt Fortman, who will give an overview of our Department of Health and Human Services 2024 requested budget.
Great. Thank you very much, Shakita. As she mentioned, my name is Matt Fortman. I'm the Chief Financial Officer for the Department of Health and Human Services. So our budget broad overview here, this is all of DHHS. We are 23% tax levy, 34% direct revenue, which is mostly Medicaid, and 45% state and federal grants. So as Budget Director Lamers mentioned earlier, we're always looking to shrink that portion of our reliance on tax levy because we know that's the county's scarcest resource, and we're looking to, at the same time, expand services through expansion in direct revenue or state and federal grants. So how do we do? Oh, I should also mention that this budget doesn't include, the budget presentation doesn't include our projects funded through the American Rescue Plan Act or ARPA or opioid settlement funds. We'll have a little bit of an update on that later. So the 2024 requested budget, our total expenditures are increasing by $14.2 million. So how do we increase expenditures without substantially increasing tax levy? We focus on programs that are fully funded by external revenue, like our Children's Long-Term Support Program, like our Comprehensive Community Services Program, like in our housing program, we're expanding housing services through HUD funding. We're also able to expand services to older adults through Older American Act specific funding. In this budget, we also have some staff and provider supports. We have new BHS paid internship positions to continue to expand and develop our workforce. For the first time ever, we have internal peer specialist positions to support the crisis mobile team and the internal community support program AOT team. We also have new Aging and Disability Resource Center positions funded through a state grant right now, but we're hopeful that we can identify revenue long-term to fund those beyond that pilot program. In terms of financial sustainability, we are seeing a very large increase in youth justice out-of-home care placement costs. That's $3.4 million. That's partially offset by a reduction in placements in youth justice corrections institutes like Lincoln Hills. But that increase in out-of-home care, we weren't able to overcome through other reductions in expenditures. So we did need to reduce some of our youth justice community services in this budget to overcome that gap, unfortunately. I should also note that we have $6.7 million of our total expenditure increase is a change in how countywide cross charges are calculated. We were held harmless for that change and given additional tax levy, but that additional tax levy isn't funding direct services. That's funding that kind of accounting change in interdepartmental charges. So tax levy remains very, very important to us. It's what we use to match important programs that require match, like a lot of our older adult services require match. A lot of our Medicaid psychosocial programs require match. So we'll always need that tax levy, but we're always seeking out ways to expand in ways that don't require tax levy to, again, meet the mission and vision that Shakita just talked about. So new position highlights. As I already mentioned, we have new positions in our Aging and Disability Resource Center related to an independent living support pilot program. We have new positions in our housing program. We have, and that's funded by the HUD grant. We have 7 new peer specialist positions in behavioral health division. Again, those are the first time we've ever had those as internal positions. We're really excited about that. we have the paid internship positions and a new position that's devoted to suicide prevention. In our youth justice area, we have new human service workers to support our CLTS program and additional quality support staff to support the expansion in our children's long-term support program. So as a part of the budget, we are required to meet our tax levy target, but we're also able to request supplemental funding on top of that. And so we just want to share some of those supplemental requests with this group. These aren't guaranteed to be funded, but wanted to share some of our priorities that we're hopeful will either be granted through that supplemental request, or we would seek out grant funding opportunities in the future to fund programs like this. So top priority would be to restore those youth justice programs cuts I discussed earlier. We're looking to have a landlord incentive program to expand the pool of housing opportunities for Section 8, both geographically and just in terms of types of housing opportunities. Increased for on-site supportive housing staff contracts. We're looking to expand our veteran service program. Madison, for example, has a larger veterans service office than we do in Milwaukee County. We feel that that would be really valuable to helping veterans in Milwaukee County receive the benefits that they deserve. And we're also requesting a increase in older adult funding to support our Older American Act programming that was advocated for by the Commission on Aging. Going into some more details here. So again, these we have some longer term projects. So the opioid settlement funds, I'm sure you've all heard about that. DHHS has access to some projects through that fund source. So we're focusing on harm reduction supplies, prevention, medication assisted treatment. We're just at the really the early stages of the opioid settlement. It's an 18-year settlement. These are the first projects that were granted through that process. We'll be continually requesting additional funds for these projects and additional funds for new projects. And again, touching on, this is the American Rescue Plan Act funding that the county has had access to. Again, DHHS has substantial funding through these opportunities, a total of $86 million in funding. A lot of that is going to the infrastructure costs of the new COGS building, but there's also a lot of other pilot programs and infrastructure building programs that we're excited about there. And I think Shakita, I'll hand it back over to you.
Thank you, Matt. So as you look at the budget, we still show our commitment to our vision. And the work that we're doing with our housing. So many of you have heard of the 120 homes. We applied for a grant from the state. We'll be building 120 homes in the King Center neighborhood. That'll be for home ownership. And so really proud of that work. Also, we'll have the groundbreaking. We've been talking about this work, but some of these things you'll kind of see, they'll be, the building will go up and we can say very proud of the work that we're doing. So the groundbreaking will take place in sometime in September. So you'll see the new COGS building there. And then the unwinding of Medicaid. So developing a robust strategy, a lot of partners there, again, just not Department of Health and Human Services or Milwaukee County, but just making sure we have a strong awareness campaign to ensure that people are able to enroll in Medicaid or find another form of insurance so that they don't lose eligibility or that insurance that they have. And then also responding to the public health emergency around youth and gun violence. So there's a lot of work that we're doing with the credible messengers, as the county executive mentioned earlier in his remarks. We're also looking at an advanced peace model that focuses on youth that deal with gun violence. So there's a lot of work that's happened with our ARPA projects that will help to fund that. And just today, right before, as county executive said, we had a press release where we put 11 harm reduction vending machines in the community across Milwaukee County. And so while we look to invest upstream, the goal really is to make sure that we are reducing the number of deaths that we are seeing when it comes to overdose. And so again, our commitment is across all of our service areas, and it's to make sure again that the people that we serve in Milwaukee County are at the center of what we do, and we're able to wrap those services around them. If you have any questions, Matt is available to answer those.
Over there, Christine. Oh, it was you.
It's amazing to think about how many things you guys cover that are so important. So keep at it. It's amazing. So one quick question about the line about subsidizing landlords to accept Section 8. Didn't the county pass an ordinance in maybe 2018, making it illegal for landlords to discriminate against people with vouchers? And I wonder if there's other strategies, and also, I guess, in terms of giving some of those same landlords money for discriminating against people who are discriminating against people. You know, are we looking at whether those same landlords we give money to are not going to be those same landlords that briskly evict people for lots of different things and destabilize lives in neighborhoods?
Yeah, that's a fantastic question. So we have, it is illegal, and we do have access to the stick as a disincentive, and we're wanting to add a carrot as a further incentive. And I think we're still looking into how to structure that program and policy so we're not creating kind of a moral hazard situation and incentivizing some bad actors when we're not wanting to. So we're wanting to be really careful about that, but we think there is some opportunity that would help expand, especially geographically, the pool of Section 8 availability.
Hello. Sorry about the mic situation. I am gonna piggyback off of Pete. I'm very concerned about the landlords here in Milwaukee County and seeing the disgusting housing issues that are here, along with the high cost of housing. So I can see that we're adding 8 case managers. I will tell you, my colleague Hope, who looks for people, helps people find housing, my wife, who helps people find housing, anyone that you could ask in human services who is trying to find housing for folks is struggling. And so I think there does need to be oversight of the landlords here in Milwaukee County, including the housing authority of the city of Milwaukee. There are really awful, disgusting situations. And so I'm wondering, why would we incentivize these Section 8 landlords? I guess I don't even have a question. I'm just saying I'm angry about our housing situation, and I'm sure you know about that. And I know that even when there is money there, that landlords aren't taking it. So while we can add more people to try to find housing, it's not there. So I'm hoping that we have some plan other than incentivizing these landlords.
Thank you. We share your frustration.
There was no question. I
apologize. Thank you for your comments.
I'm so sorry. I'm not on purpose. So piggyback off of another piggyback. Talking about incentivizing landlords. Let's even talk about, how about if we incentivize landlords for providing affordable, accessible housing? And as I also look at line item number 1, to build 120 affordable homes. Where are we at in the phase, scoping phase, contracting phase? Does that include visitable housing or accessible housing units, and how many?
I can get more information on that, but we have to do the process of getting providers to start building those homes. So we just broke ground about a month or two ago for the first home. So I believe 40 homes will be the initial phase of it, and then we'll do the remaining 80 homes. We do plan to have those homes kept at around $110,000, so not to go over that amount. But I will definitely take this back to Jim Matthew, who is our housing administrator, and I can provide that update back to Barbara Becker to send out to you all.
Or if we're talking about universal design and including everyone, all of those houses should be accessible, not just some.
And I don't want to misspeak. I believe they are, but I just want to make sure I can confirm that.
Sorry, I'm just the angry lady.
No, that you're not angry. I want to just say, we all have a commitment to housing. We all know that there is a serious problem when it comes to affordable housing. All of us, right? Even our housing team, they come and I'll say, you can go below the line just for a little bit, right? Then we have to come back and we have to talk about the solutions. Again, this is another area where it's going to take all of us, and maybe we should have some type of where all of us have to come and we have to talk about the policies and the things that are in place that we need to be advocating against. Again, remember, we all didn't create some of the things that are in place now, but it is our job to change them. And that does not happen overnight. I always have to say that, but we have to be committed and dedicated to doing that. So if you want to be a part, call me. Let's figure it out.
Yes.
Sorry.
I just wanted to share that the mental health task force is going to be having the Care Day Forum on November 12th, and it is going to be on housing.
Can you repeat that again, please?
Michael Brown I'm Michael Brown, ATU Vice President. We represent bus operators from Milwaukee County. And my question to you guys are, when are you gonna come up with the program? Because we're having, there's a big problem with homeless and people without homes. The sheriff put them on the buses at the airport. We have problems with that. What do you have in your budget to help us out, to help some of these people out? Because these people that we're talking about homeless, they're on the bus. They stay on the bus all day. I mean, some of them good, some of them, get into trouble. The drugs and alcohol problems going on. And so I see that they putting on extra in security for the bus operator for transit. They left that budget at 2.1 million. What are you guys gonna do to help out with that for mental health? Because it's coming from your area. So, and I'm looking at what program do you have with shelters stand up later and letting these people come into shelters with programs to get them back to school, reality, bring them back, help them out. With a lot of property here in Milwaukee. And I see like they just throwing them on bus operators nowadays. And so we're not doctors, we're not counselors or anything. And so I think that problem should be coming from you guys in the county for, to find solutions. Instead of, I feel like they just throw them on the bus, and then when the bus service ends, we have to put them off. And so how do you think the bus operators feel about putting homeless people off the bus? So that we know they don't have nowhere to go.
I appreciate your concern. And actually, we just met with MCTS to talk about some strategies and some recommendations and things that we can do. Sometimes we think that we should just throw another dollar amount and that will solve the problem. And so one of the recommendations, and maybe that is it, right? But one of the recommendations would be, just, and this is not finalized, but we have Administrator Lappin in the back. We talked about providing some of the bus operators with mental health first aid training. We've done that at parks in the community, some of the community wrecks, and they've been able to de-escalate some of those things that are happening. We've also talking about having crisis, the mobile team, be partners with you all. And whether that's being on the bus, whether that's showing up, but having a direct line to us so that we can help you out in some of those situations, as well as partnering with our housing outreach. So we will partner our crisis mobile team with our housing outreach team, and then you all will have a direct line to us so that we can show up and meet you where you are. And that's what accessibility is all about. Sometimes it's not always about the dollar amount. If we already have the staff who can do that, then maybe we just need to redirect where they're going and helping you to figure out, again, we're solutioning and figuring out how do we solve a problem together. And if we find that that does not work, then we need to come back to the table and come up with more recommendations.
Just a really quick question. Thank you for your presentation, Director LaGrant and CFO Fortman. So on slide 7, you have a list of supplemental request highlights. Can you talk a little bit more about how likely it is those might be included in next year's budget? And what does that process look like? Thank you.
That's a great question. There's obviously a lot of competition countywide for resources, and from Budget Director Lamer's presentation, we know that there's scarce funds to go around. I think in last year's budget process, there were about 5% of total supplemental requests were granted. So we're hopeful that we'll get 1 or 2 of our requests granted, and the majority of them will likely not be granted. And again, we'll look to grant funds and other alternative fund sources to move forward on those priorities. Thank you.
Question and a comment. The first one, it may not be for your department, but I find myself talking to people who usually wouldn't receive mental health services, and I get excited, like, hey, you got state insurance? They're like, yeah. And then I'll connect them with the provider, and then we find out that unless they have a diagnosis, they can't receive some of those services. I think it was unwinding Medicaid. Is there anything in that plan that addresses that?
It's a great question. I might turn that over to Administrator Lappin.
Never easy questions from Montreal, so thank you. So I believe the program you're referring to would be CCS. So the Comprehensive Community Services Program does require a physician's diagnosis. The program is incredibly generous in that it's essentially any mental health or substance use diagnosis with the physician's opinion that the individual might benefit from the program. So it does require that assessment. And we can talk offline about how to access that diagnosis. But that is a threshold for the program. That's part of the state plan amendment for Medicaid. We can't change that. But certainly people do not need a diagnosis to get mental health or substance use care in our community. That's a threshold for one very particular program.
Thank you. It's a challenge when you get out here as advocate and you start telling people about the services. The comment as we get ready to move on is regarding to, you said you represent the Bus Drivers Association, and then you mentioned mental health first aid and getting that training. I'm outside. I've sit with the homeless for 2-3 hours at a time with a Bluetooth speaker and a lawn chair, just trying to help. And I know it may not be ideal as we're trying to figure out the system, but sometimes that's the only shelter they have. And I'm only putting that out there because as the system is being designed with the community in mind, you guys are sometimes the first responders for these folks. I done found people OD'd. I done been to calls where it's blazing hot outside or super cold, and you go back and that person has passed away. So I don't know what type of conversations need to happen offline, but maybe with these 30 new buses, we can be really intentional about providing some shelter as we try and find other community partners. Thank you.
Well, I know we're out of time and need to move on to our last speakers, but this is probably my last budget briefing. So Shakita, I just wanted to thank you and your team, you know, your optimism and your leadership, and you've got such a big job. So thank you. Thank you.
Okay, now we need to move on to the Milwaukee County Community Reintegration System Center. Chantell, Jewell, Superintendent, and Michael Bickerstaff, the Public Safety Fiscal Administrator. Hello there. Good to see you.
Good afternoon, everyone.
Good afternoon.
Once again, my name is Chantell Jewell. I am the superintendent of the Community Reintegration Center. And last year, this time, we were the House of Correction. So I don't know if you all know, we had a name change. We wanted a name that closely aligned with what we actually do and what we are about. which is helping people to leave in a better place than what they came into our facility, addressing their needs. And really that is really how we begin to impact public safety. So we came up with Community Reintegration Center. That being said, next slide. Our mission is to promote successful community reintegration by providing programming and resources that comprehensively meet the needs of residents in our care, which support opportunities for positive change. The vision of the Milwaukee County Community Reintegration Center is to enhance public safety and quality of life through the successful reintegration of residents in our care. And so Mr. Bickerstaff will talk to you about our 2024 budget request.
Thank you. Our 24 request has $56.5 million of expenditures. That's a $1.8 million increase from the previous year. Our revenues are down 180,000 down to 5.9 million. Total tax levy will be $50.5 million, or total increase of almost $2 million. Okay.
So we have several different strategic priority areas that we're going to discuss here. The first strategic priority area is administration. And really, our focus in this area surrounds staffing. As many of you know, we have suffered significant staffing issues and shortages in corrections. And this is not a Milwaukee problem. This is a national problem within corrections. And so here, the CRC's hiring team has been very successful in reducing our vacancy rates. And we will continue to work to attract and hire and retain a diverse workforce. In 2022, around this time, actually, when we made this slide, we were at a 30% vacancy rate around this time last year. When we made this slide, we were at a 23% vacancy rate, and I'm happy to report today we are at a 20% vacancy rate at the CRC. That deserves a hand. Our goal for 2024 is 11%. We also requested to created in this budget one contract services administrator position to help manage our $29 million worth of contracts. Those contracts include our healthcare contract, our food service contract, contracts such as our day reporting center, and other programs. Next slide, please. And so this slide is just a visual of kind of where we were with staffing and where we are with staffing. As you can see, last year, around this time, we had 167 security staff, sergeants and correctional officers. And today we are at 209, which puts us at a 20% vacancy rate. Our goal for year end is 215, so we're almost there. And first quarter goal for 2024 is 230 staff. Fully staffed for sergeants and correctional officers will be 259. And so, next slide. You can see that our population is continuously increasing. Last year, right on this date, we were right around 628 people. Today, we are at 983. So that's kind of, the population is steadily increasing. Our staffing levels are not as catching up as quickly. Next slide. So our next strategic program area that we're focusing on is medical and mental health. There's been an increase of 573, 573. Get the number, Mike. I don't know why I have an MBA. I don't know why I'm struggling here.
$573,490.
I knew that. due to contractual increases with the county's correctional health provider, which is WellPath. We're also getting additional funding from the opioid settlement, which is huge for us. I don't know if you all know, we have a full MAT clinic now. We are, I believe, the only facility in the state able to offer methadone in our facility. And so with this increased funding, we're able to hire one full-time coordinator, MAT coordinator, one RN, one LPN, 1.5 full-time peer specialist, and 1.5 behavior health counselor. And so we will be able to increase the number of individuals that we're serving. And so we all know we're all concerned about the opioid epidemic in our community, the high prevalence of overdose upon release. And so this is our response, and this is how we're responding to that here at the CRC. And our next slide. One more. Our next strategic program area that we're addressing is programming. And so what we're doing, we brought on our human service worker who will create reentry plans for everyone who is sentenced to 90 days or longer at the CRC. We're trying to be very strategic and intentional about programming. So first, we have to identify the needs through a validated risk assessment, and make sure we're intentional about making connections. Long gone are the days where we're just throwing people into programs. We want to make sure we're addressing what those needs are that are driving those criminal behaviors, so that they are less likely to reoffend when they enter into our community. But the other part of that is, and I see some of our community partners out there, is that we also know, hence Community Reintegration Center, that we need to partner with our community because people are only at our facility for a short period of time. And so the work begins at the CRC, but it has to carry on in the community. So, which we jumped down to bullet number 3. We've also added a family outreach coordinator, first time ever in our facility. That is a family connection. So as we're creating these reentry plans, we want to have a loved one walk through these plans with these individuals. When I worked for Department of Corrections, and as we know, evidence-based practices and principles, one of the drivers of recidivism is family distress. And I asked my boss, if we know this, why aren't we allocating any resources to that? And I was told, well, we can only spend money on offenders. We can't spend money on their families. Well, guess who's the superintendent now? Position where we can now allocate some resources to working with families. And so as we're creating these plans, we want to make sure that there's a loved one that knows what the plan is, so they can help these people stay connected and walk out the plan in the community along with those other community partners. And so we've hired a family outreach coordinator. And so along with the human service worker, along with WellPath also has a discharge planner, next slide, on their team, who looks at housing needs, case management needs, mental health care, financial planning, things of that nature. So all of it's interrelated. We still have our housing navigator through DHHS. The position is vacant now, but we have the position. In our supplemental budget request, we did ask for funding to support that position. So again, we are just seeking to make sure that whatever that need is, or whatever's driving those criminal behaviors, that we are addressing those needs when individuals come into custody, come into our facility, and leave it in a better place. So in closing, the recommended budget is aligned with Milwaukee County's vision and provides resources that will have a positive impact on our staff, residents, and the community. And let me just say this about staff. We talk about residents all the time, but staff wellness is also equally important. So we're allocating resources, mental health resources to address the needs of our staff, because I truly believe that our staff need to be well to make sure that our residents are being served well. And so we are, and this is a tough job. This is a tough job. Correctional officers have higher rates of PTSD, suicide, depression than the military or police officers. So we recognize that. And so we're making sure that we're taking care of our staff. And so that they can take care of the people. And so the post-pandemic management of the CRC brings about the reality of an increased population with staffing shortages. We are continuing to work on organizational culture that will attract people, not only attract people, that we can retain people, a place where people want to work. And that was all tying into our name change, our new vision. Hopefully, you know, people that were not typically thinking about corrections per se will be attracted to the Community Reintegration Center, because we are more than corrections. Yes, security is the cornerstone of our work, but again, we're all about helping people and making sure that they return to the community in a better place. So it's big picture, way bigger than just corrections. And so this budget proposal does not cut any programs that will impact those returning to the community, but does seek to enhance existing resources and services. That's all I have.
Thank you, Superintendent Jewell. How do you, what kind of job do you think WellPath is doing?
Question, Mary, no, really.
So WellPath has been a good partner to us at the CRC. But overall, WellPath manages county services. So WellPath also manages the county jail, provides healthcare for the county jail. So.
I think we're gonna combine questions.
Yes, we will. Don't leave yet. More to come. We will ask combine questions. Okay, I'd like to welcome Milwaukee County Sheriff's Office, and we've got Chief Deputy Daniel Hughes with us today. And you will have the time that you need.
I wasn't sure if I got up here any later, I might have been saying good evening instead of good afternoon. I'll stick with that. The microphone.
Yes, you are.
That requires coordination. I don't know if I can pull it off, but I'll try. Good afternoon, everybody. My name is Daniel Hughes. I'm the Chief Deputy, which effectively means I'm the under sheriff, the #2 for the Sheriff's Office, under the leadership of Sheriff Danita Ball, who did not lead it today. Gladly present for her. So going forward, exercise in there. Okay, our mission. Our mission is to serve and protect everyone within Milwaukee County with fairness, integrity, and respect. Our vision is to be a model public safety agency based on service and trust. And our values, as a team, we're committed to commitment through service, through and by motivated, dedicated, and well-trained employees, which I know that Chantell touched on earlier. Consistent, objective, ethical standards and what is right and what is proper, and also free from self-interest, racial injustice, favoritism. And we are committed to earning and maintaining the trust of our community by being personally and professionally accountable. our budget request, total requested expenditure authority this year is going to be $67,337,237,231. Why am I having a problem? When the numbers get too big, I think we just maybe should just let somebody else read them. Our total revenue authority, which would be anticipated money coming in, would be $11,155,734. And then our total requested tax levy, thank you, would be $56,181,497. I'm not sure how much everybody in this room knows about the sheriff's office. I always like to sort of point out some of the things that are obvious to me, being there for almost 27 years, but a lot of people don't know. There's a lot of things that we're actually constitutionally and statutorily mandated to do. Run the jail, run the courts, do civil process, right? Statutorily in the state of Wisconsin, we are required to patrol the freeway system as well, which was started in the late 60s-ish timeframe. So the state patrol you'll see is everywhere else in the state of Wisconsin, but we are the primary responder and enforcer on the freeway system within Milwaukee County. As you'll note on the program areas that we have, money dedicated to, the biggest ones, the three biggest ones are the county jail, the police services bureau, and the court security division as well. So those are the three big, really big, but bread and butter divisions. All three of those are, where the majority of our people and our personnel are assigned. We do have airport division, which is a contracted service. So you'll see that there isn't a whole lot of expenditure there. That's because we get reimbursement from the airport for almost all of the day-to-day operations, save the $212,000 that's mentioned. Investigative services, that's an area that's really increased for us. Unfortunately, with crime being the way it is now, we have had to take a bigger step forward in our investigations division. We've had to investigate, things that were unheard of for our agency would be homicide investigations. We're doing them very frequently now. So that's something that takes a lot of people, and it takes a lot of training, and it takes a lot of commitment and dedication to do. And that's, an increase of what we've been dedicated to in the past. Also within the Investigative Services Bureau, we have what's Mike Lampin that helped us start this up. We have our CART team, which is the Crisis Assessment Response Team, which is a group of deputies and clinicians that go out in pairs to, assess people out in the field to try to divert or assess them in the field and divert them, not so much from bringing them into a mental health facility, but, hopefully finding places where they can go or services that they need, or, perhaps bringing them somewhere that they can receive help other than a more public location, or, at the end of the day, the Milwaukee County Jail. As far as mental health and within our agency, I will piggyback on what Chantell mentioned earlier. It's very important to us as far as our staff and what we have been challenged with and what we have seen over the past 4 or 5 years just with our own personnel. We started under the last administration, but Sheriff Ball's definitely pushed it forward as the peer support team. Internally, it's 25-ish members of our agency that have some specialized training to help our own people deal with the stresses and the rigors that we're facing and the constant exposure to, quite frankly, pretty dramatic and pretty graphic scenes that we've just had to deal with and have always had to deal with, but now we have a way to get some more assistance than we have in the past, and really in my day being out there. We also have a very robust chaplaincy program that we're proud of as well, where we have a lot of staff chaplains that we partnered with, and they're very active with us, not just for special events, but if we need something. I just literally called one 2 days ago for one of our officers that just needed some extra help for something traumatic that was happening in their personal life, and he was out there within a half hour talking to the deputy. So We just really appreciate it. And we're very proud of that as well. So that's basically the breakdown of our expenditure authority this year. Anticipated, that is. Our priorities, achieving a safe county and Milwaukee County Courthouse and other facilities are a big part of our footprint and our priority that we have a lot of, like I said, personnel assigned to. 90-ish people are in the courts division, depending on the day and our actual staff. We're obviously very dedicated to achieving safe parks, proactive patrol strategies on our freeway system. We've had to kind of rework the box a little bit with our patrol strategies over my career timeframe. I mean, we had twice the number of deputies out on the freeway system that we have right now, and that's just because of the consistent reduction in staffing, and that was related to funding and all of these things that have just kind of, you know, we talk about county has made cuts over the years, and they've just cut, and we've had to adjust as well. So as much as we'd like to be out there more than we are and have more people out there more than we do, we have as many as we possibly can out at any given time. Patrolling the 158 miles of freeway systems and 160 plus parks in Milwaukee County. So we do as much as we can with what we have, and we will continue to do that for sure. And then, of course, effective and efficient investigations, which I just touched on. People don't realize with investigations, I mean, it's so much of it is so much not like television. I just can't tell you, you know, the one thing they don't tell you, you know, when you're signing up to be a cop is how much reporting there is that has to happen. You get 5% of the time, you know, you're doing the cool stuff, and then 95% of the time you're typing, which is what I can't see anymore. And also, but yeah, it's just so important with the investigations that all the I's are dotted and the T's are crossed for those cases, not only to you know, to come to fruition in a court system, but to provide a measure of justice to the families who have been victimized out there. And we really take that seriously, and we find it very important to us to do a good job with. We're committed to advancing correctional best practices, ensuring safety in our jail, committed to personal excellence and addressing recruitment, hiring, and retention. I'll touch on a couple of those things real quick. Forgive me if I'm talking too fast. I'll try to slow down, but I don't want to cram a little bit in here. Safety in the jail. Obviously, that's been kind of a hot button lately. One of the big things that we're pushing forward right now, well, one of the big things that we did just this past year is we committed a police services captain to go into the jail and work as an occupant inspection and compliance captain. And what that means is all the correctional officers are required to you know, do rounds throughout the facility, no matter what time of day it is. It's 24 hours, 7-day operation. So you know, our staffing, which I'll get into, has been extremely light in our jail, to be quite honest. And so, you know, you have people, and we have a high turnover rate. So what we've been having to deal with is people who are very new or perhaps inexperienced training other ones. And we've just had like a degradation of what needs to be done. So what we did was we put this captain in there to try to hold people accountable, to do spot checks and to review videos and to do assessments on electronic, they call them schlag cards, but basically it's a little card that indicates that they were doing what they're supposed to be doing throughout the facility. And we've really seen some really great movement forward in doing that and success going forward. And one of the things that we've also found, you know, we try to leverage technology as much as we can, when we can get funding. So I know one of our capital improvement requests this year was actually, you know, kind of pending right now, but it's called the Guard One system, which will put best way to say is little keypads on all of the doors and all of the cells everywhere. And it'll take a deputy or a correctional officer will have a little wand and be able to go around and actually verify that they check every door, not just going into one pod. Because there's two boxes in the back of each pod. which, you know, you can go hit the boxes, but are you really checking all of those things? Well, that's one of the things that our compliance captain is checking on, but now we have the ability to leverage technology potentially with our requests and have a system that would allow us to verify and then get a warning to the supervisors if one has been missed or it didn't happen or whatever the scenario or situation is. So, you know, our people have looked out and tried to find new things, new ways of doing stuff. And I really appreciate them doing that and trying to find new ways to do the same things that will make the whole environment safer as a whole. Our challenge with staffing is just as dire, if not more dire than the CRC has been in. We're currently 95 people short in our correctional staffing contingent, which basically means that we're down 38% of where we're supposed to be currently. We turn over 100 people a year that come in and then leave, whether they're it's just not for them or it's too much to handle, or, you know, quite honestly, sometimes we have to terminate or fire people. So it's been a challenge like that for quite a while. And as Chantell said, it's not just a Milwaukee County challenge, it's a state challenge. It's a country challenge. I mean, it's the same all over the place, but it's definitely hitting us pretty significantly and has been and continues to. Personnel changes to combat the staffing shortages in the jail. We have $6.06 per hour pay increase for correctional officers, captains, and lieutenants. So what this is aligning with, I don't know if you guys have heard it, but with Act 12, there was a mandate in there to change the correctional officer pay and competitive nature of it. And the state of Wisconsin got approval to pay their correctional officers $33 an hour to start. So how does that translate to us? Well, we're around the mid-20s. And we've already had 3 people leave as soon as they heard that passed, and we have 3 pending. So that's an issue right there in and of itself when our numbers are so low. And then if you recall, the state is building a juvenile facility in Milwaukee County that will be up and running within the next year or a year and a half. So it's not too far of a leap to think that perhaps they might try to, our people would leave to go there for that wage amount. So that being said, we put in for the $33 an hour for our people as well. As a starting point, I think we would like to see it even higher, quite honestly, to make us, I say a destination employer, but it's really a wage that would make people want to come to us instead of just equating to where everybody else is. And that way we would be able to recruit people that may want to have this as a more long-term career as opposed to more transitional type of employment. So that's kind of the deal with that. New positions, we're requesting 33 deputy sheriff positions to combat overtime, staff shortages in the courts, patrol, and investigations. Really, that is not even close to what we truly need. I just cut my finger on my knife in my pocket, so so what we have is we have we're authorized 273 deputy sheriffs. Yeah, I'm holding it now. Maybe if you have a little bit of an issue or something.
We got something coming.
That's all right. So I'm used to working in here. Appreciate it. All right, so we'll carry on here. So 273 deputies that we are supposed to have. We're at about mid-250s right now. We do have quite a bit of success bringing people in. It's a long process. It's over a year to onboard a deputy sheriff and get them trained and then get them out there. And even then there's a training, field training lag time as well. So, but one of the things that we really struggle with our staffing being low, and I know a lot of places have this, but Even a lot of places in the county have it, but the uniqueness with us is that we are 24 hours a day, 7 days a week. So when somebody calls in sick or doesn't show up for whatever reason, we have to fill that position with somebody else. And if we're not up to our staffing maximum, we not only have to fill vacancies that because people are calling in or whatever, we also have to staff the ones that aren't filled on top of it. So it's not uncommon for as an example, our courts division, we have 25 mandates a day that are going on in there, which means those deputies are either working their off day for 8 hours or they're working a double shift that day. 8 hours in the courts and 8 hours out on patrol or at the airport, 16 hours. So those are long days. It's an exceptionally long day when you're in law enforcement, especially when everybody's expectation is that our officers and deputies make good decisions that are critical, life-saving in nature, in the blink of an eye, without any lag or hesitation. So that's a challenge for us. We really want to get our people, our numbers up with our people to the maximum amount we possibly can. 273 is not even the right number, in my opinion, for our agency. We should really be somewhere in the neighborhood of 350 for our agency to really be operating at optimal levels. We have sergeants in here, 5 FTE sergeant positions we're requesting. We have a pretty decent supervisory gap, especially in one particular division. That would be the courts division. We have 2 sergeants for about 98 people. So maybe a 1-to-50 ratio, right? In law enforcement, it should be about 1-to-8, 1-to-9 in normal law enforcement. Our patrol division, we're asking for 3 to go to patrol because although we have about a 2-to-20 ratio right now, the majority of our young people that are newer to the job, and like the 1 or 0 time frame to 5 years, are out on patrol. We'll leave it to all the young kids who go out on patrol, right? But there's a supervisory component to that that's really critical and important to make sure that they're doing what they should be doing and how they should be doing it, and to the level and expectation that everybody expects, right? So to that end, it takes supervision and it takes sergeants to do that. We're also requesting 346,977 for bailiff positions, to start a pilot bailiff program to reduce overtime by employing certified former law enforcement officers as bailiffs in the courthouse. So what we want it to be is an hourly system. Remember, I talked about the 25 positions a day we're trying to fill on overtime. Well, instead of burning out our full-time deputies, we're hoping that we can attract part-timers that have recently retired, preferably former MCSO personnel that already know the job, and then get them in on an hourly basis to fill the gaps. And they won't cover everything, but they can offset a whole lot, we think. We've requested additional 286,894 for hourly background investigators to alleviate the 3 to 4 months lag time. So that's kind of goes to the point of recruitment, right? We have, like right now, we have like 78 backgrounds in the hopper. And we have 10 part-timers that work maximum of 20 hours a week. So the lag time that it takes to get people hired in the positions is way too long. In fact, I'm now having to commit full-time staff to put them into that area just to get the ball rolling faster. And I've been doing that for a while. Anytime we have light duty, or now I'm putting full duty people in there to try to expedite the process of getting people hired and getting people in. That's what we're trying to do. So with this request, we're trying to increase the background investigator cadre and help, just support that, so we don't have to use regular deputies who really should be out there doing A, B, or C in the field. Other major changes, requested 366,862 for pay compression resulting from the anticipated Deputy Sheriff Association settlement. Right now, our deputy sheriffs are unionized. They're an association. Our correctional officers are not. They're under, we're in contract negotiations with them. They're actually in arbitration for their wage amounts because we weren't able to come to a voluntary agreement. So it's anticipated that, they'll either take, the arbitrator will either take our amounts or they'll take their amount that they should be getting paid. And when that happens, you then create a pay compression issue with all of the supervisory staff that are above them. And in fact, it's not infrequent in fact, I think it is right now, or we have a lieutenant that's making like 7 cents more than a sergeant right now, which is just, it's a total disincentive to want people to take rank and move up, which are all critical positions. Every rank structure has a different set of responsibilities and things that they need to do and need to account for. And one of our biggest transitional problems is getting people out of the sergeant rank into lieutenant rank. The sergeants are part of the union, the lieutenants are not, and their pay wage compression issue is really tight. Let's see what else. Collateral agreements we have on there. That's an agreement that we're trying, or we have now in place. It's signed and went through the county board. And what that allows us to do is 2 things. Number one, the deputy sheriff's standby pay has been set at $10 since the early 1970s. So if we needed them to go be on standby for a day, like our detectives are it's on call or on standby. They're on call for a 7-day stretch, 24 hours a day. Their wage for that was only $10 that they were getting until they got called in. So their entire life is obstructed. Essentially, their private life is obstructed off duty time for $10 a day for 7-day stretches that they rotate through every 6 weeks. So we changed that to a agreed upon wage of 1 hourly, highest level of hourly straight time pay. So that it's never going to be stagnant like it was for $10 for 40, 50 years. It's going to change every time the wage scale changes. And then additionally, we're trying something new. We have this, it's an on-call agreement essentially with, for the courts division deputies to rotate a very specific on-call, which we can't do a collateral agreement on, in order to cover hospital watches, which you wouldn't think are a huge issue, but it's a huge issue for us. People who are in the jail very frequently need to go out to the hospital for medical treatment that WellPath is not able to do at the level that perhaps these people need based on whatever their medical condition is. So that requires a hospital watch or a hospital alarm to go out, which means we have to pull deputy sheriffs either out of the airport or off the freeway or out of the parks to bring them to the jail to escort the occupants to the hospital to then stay there with them the entire time they're getting treatment. So again, we're robbing Peter to pay Paul. We're bringing people out of essential services that are out in the field to assist with crime and enforcement and assisting people out in the field, and then we're having to utilize them in the locations that we would want to have correctional personnel. Other few last couple of major changes, we have increased.
Wrap up then. Okay, thank you.
Yes, ma'am. All right, well, I'll just flip through here. We have a couple of $760,000 in cross charges, which is essentially just a new way that the county's having this account for exchanging of money for services within the county. Revenue reduction is sunsetting. We used to serve Freighter Memorial Hospital as a security contingent. That's sunsetted. That's been transitioned over to Wauwatosa Police Department. And then a little thing called the Freeway Service Team, which was a yellow truck that was out on the freeway that would help people change tires and stuff on the freeway system. We're transitioning out of that. And then we've increased our mitigation contracts. Mitigation contracts are basically construction contracts. So there's so much construction going on. We have to assign deputy sheriffs out on the freeway system to assist with those things, and we get paid by the state to do that. So I know that's a mouthful, and I know I tried to smash as much as I could in that amount of time, but does anybody have questions I can field for you real quick? Yes, sir.
Have you considered unionizing your corrections officers? It sounds like you could use
So that would not be me that would, push that, but I know that they were union for a while. Act 10 it dissolved the union and they had the opportunity to recertify at the time, and I don't believe they did, and that's why they're no longer. My understanding historically. Anyone else?
Got a couple questions for Superintendent Jewell. So I know we've got one over here, we have one over here for Superintendent Jewell. Patiently waited, so let's field those questions. And then Barbara's going to close us out.
See, I get first aid here, Juan.
One question for their department. I did hear you say for staff wellness, which I think is so very important, and I'm a witness to it, watching it in corrections. But did I hear you say sending, you have chaplains to respond to staff who are experiencing trauma in their personal lives?
Yes, so it's a volunteer chaplaincy program where they have signed up with our agency. We vetted them through our process. We actually have policies and procedures for them, yes. And then we have a whole list of them. So if we have issues, we would call them, whichever one. I mean, the officers or the deputies have the ability to call them on their own. A lot of times, if we see a problem as supervisors, we'll call on their behalf and just have them check on them.
That you do recommend adding a clinician to help work them through seeing that firsthand. Your staff does deserve better. Far as making sure their wellness is okay. And I'm a former WellPath employee and left very, very disappointed. I did not want to leave that position, but I did not want to be connected with that. I do believe as a healthcare organization, we should have been responsible for training you better. And responding to you. They're basically sitting in a psych ward. And without any clinical training or the appropriate training that you guys can't give, that we have a responsibility to assist you with. So I do really highly recommend that be added. And I hear you, Mr. Superintendent, like hearing your vision, I actually believe you. Because being there, you are not being represented well at all. It is horrifying. What I just went and just left 2 weeks ago. So I was planning on reaching out to you. I've sent numerous of emails to leadership and wellness about what's actually going on that they don't see, and it's being completely ignored. But you are creating patient harm in that facility, and your staff is also being harmed with being uninformed of the information that they deserve to have.
One more question.
Thank you.
Whose question was it? Barbara?
Thank you, Chief Deputy Hughes.
Barbara winds down her time with the mental health task force. I'd like for her to be able to wind down her last budget briefing.
Well, thank you very much. Well, first I want to thank everyone for hanging in with us because I know it's been a little longer than we anticipated. And thank you to all of our speakers, and special thanks to Montreal too for providing the live streaming. The county budget is so important to people with disabilities, mental health needs, and older adults and other community members. And it is so important to have a strong voice in influencing the process. And we're at the beginning of the process now. So this is the time to get involved. And I'm really grateful to all of our speakers, including those who are still here. And I apologize, Superintendent Jewell and Chief Deputy Hughes, that you got a little bit of a short time at the end. And I will note that for my successor, so they can consider that in planning for next year. And you can be earlier in the agenda. So you have my promise. So thank you very much. And my last comment is just to remind everyone that there is still time to submit a nomination for the Jean Lowry Award. Jeannie Lowry was past co-chair of the Mental Health Task Force, an incredible advocate for people with psychiatric needs. She was a psychiatric nurse who worked with people experiencing homelessness and We have Jan Wilberg here who's got the information. So it's a really a meaningful way to honor the people who are doing this important work. So let's come through with some great nominees. Thank you very much, everyone, and thank you to our speakers and the staff.